CMH has really had an interest in mental health recovery for a long time. And in our planning and our recovery blueprint, the issue of wellness and health has been a dominant theme. At the same time, the recent studies said that people with a serious mental illness on average die 25 years younger than the average person. And I don't think it would surprise any of us that smoking is a big part of that.
Well, we were one of 5 grants awarded from the National Lung Association office, and we're honored to get the grant to work on tobacco. And we thought that there was a big need looking at this population, people suffering from mental illness, because a large number of these folks use tobacco.
We sort of have a mission that covers 3 areas. First is prevention education for tobacco use. Second would be to protect the public from the harms of tobacco. And then the third would be to help people quit the use of tobacco.
44% of all tobacco products sold in the United States are sold to people with serious mental illness. So ultimately, we had this great opportunity to partner with the American Lung Association about this grant opportunity.
With the grant, we've tried to address what we've known to be the best practices.
We had this opportunity to really look at what might make a difference in the lives of people we're privileged to serve.
We're asking, do they use tobacco, advising them to quit, and then assisting and arranging their follow-up every visit. And that's a big change, you know, to get people on board as far as staff and what to do. So that's a big part of this grant.
This is the first project of the 46 CMHs in Michigan that have really tackled it the way we have.
Part of the project includes making the campus tobacco-free, and even though it seems separate probably to most people, it's considered by the CDC an evidence-based way to help people quit.
This is really done because we're a healthcare facility and we're really wanting to help people have healthier lives. On the other hand, I've clearly learned that 70% of all people who smoke want to quit.
I was invited to join a group of peers to go to a visit to the American Lung Association conference in Dallas, Texas, and I felt that smoking while at a conference for the American Lung Association might be embarrassing. So I took that as the universe giving me a signal that now is the time to quit. Wanting to quit is not the same as being ready to quit. It takes a lot of determination. You have very real withdrawals. It's an addiction. So once you're ready and you've decided and you're determined, go get help.
The grant has brought into our lives people who can be really great resources to us. It's also brought us great resources, educational materials.
We've got websites, we've got quit lines. Some of them you can sign up and even get support online, or do a curriculum on your own, or there's community classes. We know that group support is the most effective.
The structure for a quit smoking group is actually more of a tobacco education group. We offer you tools to actually start planning how to quit, when to quit, what tools you're going to use to quit, nicotine replacement therapies, be that prescription, non-prescription, also behavioral adjustments, self-soothing skills. There's a lot that goes into it.
And in the long run, we certainly would like to have fewer smokers overall, fewer people who use tobacco products.
I think Northern Lakes Community Mental Health will do an outstanding job based on what I've seen. Their staff are so excited about the helping people part of this, and the success that they could see with their people and the health impact this will have, or improvement in health. So that I would say the staff are going to see a dramatic change over a period of time.
People who we serve, well, they have a history of use of tobacco products. Maybe there's alternatives to that. Maybe we just have to give them a chance and give them the right support.
With these changes, you don't see success immediately sometimes, but over time, I think knowing that people want to quit, they want to be advised on how to do it, this population is going to see a significant reduction in tobacco use.
It's truly a marathon. I mean, this is not going to click that switch on September 15th and everything's going to be perfect. We're going to have some challenges along the way. And I think success for us is going to be one person at a time. But we'll see where we're at in a year from now. I think we'll be in a better spot.